share with us, what are you doing? What are like one or two things you believe today that has really worked for you from a marketing standpoint?
There's this saying, create something great and they will come. In New York, if you just, when I walk home every day, I walk on Park Avenue past, 150 plastic surgery offices. So instead of focusing on competing and out marketing someone else, I think the key is really honing in on developing an incredible product. And the product's not just, results surgically, but really getting a reputation for taking exceptional care of patients. I'm no expert in marketing, but I really treat plastic surgery as an art, and I think it is, and it should be treated as such. So you basically focus on before and afters that are standardized, like art, where patients can objectively, see what you're offering, right? So it's not about, there's that saying, the squeaky wheel gets the grease, right? The louder you are, the more attention you get. And a lot of people follow that model. I think I just kind of show what I have, and I work with it's a word of mouth type practice, and people see the before and afters, and we do have a small following on social media, but we focus on the result, and it takes time, but it happens slowly, and you get busier and busier.
How much do you believe patients want this sort of like constant flow of content coming from you versus, spending your time operating, right? Like being a doctor?
It's challenging, honestly. I'm happiest doing what I do best, and I'm happiest operating, right? And I'm operating almost every day, and I don't have the time to, shoot content all the time. You want your surgeon operating. You want your surgeon, not spending every day having 25 reels posted. You want to know that they're doing what they're supposed to be doing and doing it very well, and getting the reps in, as they say. It's just the way it is. We try to stay as busy as we can on social media educating patients, but we're also busy operating.